Gwynne Lee, co-president with the Johnson County League of Women Voters. Welcome to Let's Talk Issues, a public service program co-sponsored by Johnson County Community College, the Kansas City Star, and the League of Women Voters. Tonight's topic is the ABCs of healthcare reform. Here to introduce tonight's panelist is Julius Karash, a freelance journalist, blogger, and a former healthcare reporter with the Kansas City Star. Thank you for joining us, and now let's talk issues.
Good evening, everyone. Thank you for being here, and thank you for watching us at home tonight. The name of the program is Let's Talk Issues. Tonight we're going to talk about the ABCs of health reform, the most important issue our nation faces today. And tonight with us we have Janis McMillen, board member of the National League of Women Voters, who heads a league task force on health education, and Representative Mike Kiegerl of R-Olathe, who owns a professional rehabilitation management of R-Olathe, and Corrie Edwards, executive director of the Kansas Health Consumer Coalition. Thank you all for being here. I've got some questions that I prepared, and don't wait to be called on. Just if you have something you want to say, jump in. How would you characterize the effectiveness of our healthcare system as it currently exists? And in other words, what would you say are the system's strongest and weakest features?
Okay, go ahead.
I'll jump in and say that I think that there are elements of our healthcare system that are effective, but I think it depends on what consumers you're talking about, because for those of us who are fortunate to have health insurance, then the system can be reasonably effective. If you're one of these individuals who either has insurance but it's not adequate to cover your needs, or if you have no health insurance, then I think you would probably say that the healthcare system is not very effective. It's very fragmented. It's hard to get your hands around how we're going to reform healthcare just because of the fragmentation. So I would give it our current healthcare system a mixed grade, quite frankly.
Well, I kind of agree with that. Our system is not as bad as it is being portrayed, and that doesn't mean it can't be improved, and it must be improved. But the quality of medical care in this country is exceptional, best in the world. People come from all over. We still do most of the research and develop most of the medications and drugs and cures for diseases in the world that the rest of the world takes. So we have a very, very good basis for taking care of the health problems. Our problem is in the delivery system, which the previous speaker referred to. While our aged population is covered through Medicare, and our children are covered through S-chip, and our very poor are covered through Medicaid, there is a gap between those and the rest of the population, which is not always covered and can fall through the crack. And this is the issue that we need to address, and we need to take a look at. And as we progress, I'm sure we're going to have some more answers to the question.
I would agree with Mike. I think that, currently in Kansas, it's very difficult to get any kind of coverage if you are low income and a childless adult, as we call it. So therefore, you've got many adults who cannot qualify for Medicaid. They make too much money because our Medicaid federal poverty level for childless adults is so very low here in the state. I would say that, going back to the strengths, I would agree with Mike. We do have cutting edge health and medical technology in this country. I think that our weakness, as Janis indicated, would be the lack of access to care, especially in rural areas, even if you do have health insurance. I was out in Ashland, Kansas, which is about almost 7 hours away, and you can have great health insurance out there and drive 2 hours to see a dentist. That is the closest dentist. And, and the other issue is the cost of care. I mean, even for those of us who do have health insurance, our deductibles are high and our out-of-pocket expenses are very high at this point.
I think just to add another dimension to this, Over the years, the numbers of primary care physicians has declined relative to the numbers of specialists. And so in these small communities, trying to get a primary care physician even to go to a small community is becoming harder and harder. And if those individuals in small communities need specialist care, then their drive and their cost is becoming prohibitive for many people. And I think in the rural southwest part of the country, the numbers of women with very low birth weight babies is increasing dramatically because they don't have obstetrical care, prenatal care that they need to go through a completely healthy pregnancy.
One of the big challenges. Our system of employer-based coverage grew out of World War II, when companies offered health benefits to attract workers amid wage and price controls. Do you think employer-based coverage should continue as the primary underpinning of our system?
Well, I'll take that one. I don't know if I would say primary. I think it's a vehicle that we have to continue to use. There's no question that employer-paid insurance and benefits are going to be required if we're going to make a transition to a different system, but you cannot cut this out. What we need to do is make sure there is transferability and portability so that you don't lose your job, you also lose your insurance. So this is one of the major issues, but you cannot, no matter what you do in terms of realigning healthcare delivery, you cannot cut the employer out completely at this stage. I think it would be a chaos and unworkable.
I would agree with that. I think that the portability and transferability is probably the largest issue. I think that with this last recession, people took a huge hit. They lost their jobs, therefore they lost their coverage. People could not afford COBRA, even with the federal government's help. COBRA is simply too expensive for the average American to afford. This certainly affected my family. My sister, her husband was laid off, and they could not afford their COBRA coverage. I think the real issue is, and I agree with Mike, you cannot eliminate the employer at this stage of the game, but the fact of the matter is, when you lose your job, that really should have no bearing on if you have health insurance or not, and I feel pretty strongly about that.
I would agree with that latter comment, most definitely. I think if there is a weakness in the employer-based system, which has served this country well for many years, when we are now entering or in the midst of this economic downturn, then there are just millions of people who don't have health insurance anymore because they're unable to find either a job or a job that for which the employer will provide insurance coverage. So during the reform process, we have to consider shoring up that type of system.
The federal government has been involved in health care for many, many years. Medicare and Medicaid were passed in the 1960s, and right after World War II, the Hill-Burton Act provided federal grants to modernize hospitals. In your views, how big a role should the federal government play in our health care?
We're not all jumping to answer this one.
I'm eager. I'm chomping at the bit, but I'll let you go first.
I think that, my take on this is pretty simple. I think that the role of a government is to protect the health and safety of its citizens. And I don't view a health reform as a federal takeover. I don't. I believe that the federal government should weigh in on health care to ensure the physical and financial stability of this country.
All right. My view is a little different. I think the federal government has amply demonstrated that it is not capable to run a healthcare system. Take a look at Medicaid. Medicaid is broke. Medicaid puts unfunded mandates on states so that they pay us a bill in Washington. We have to pay most of it or some of it. and look at what happened to our VA system, where our wounded veterans come home to inadequate care. So I do not believe that the federal government ought to take over any healthcare program whatsoever. I think the federal government has a duty to oversee and to control, but not to run the programs. This is what I find is really very dangerous in terms of the bills that we now see before Congress, which nobody really knows much about. I've not read the 1900 pages, but I've gone to some conventions to listen to some of the explanations, and I have read and I've seen the talking points, and I see a takeover. I cannot agree with the previous speaker that this is not an attempt to take over healthcare. It certainly seems to me that's what it is. And if you combine this with Medicare, Medicaid, and the VA, I'm very worried about, not myself, I'm old, I'm going to not be around very much longer, but my children and grandchildren, because I see that we are trying to emulate some of the programs that exist now in the world in other nations, and I'm very, very familiar with particularly the Canadian, the English, and the German system. And I do not want this type of system in the United States. It would not serve us. I want to say one more thing which may be a little controversial, and that is no one in this country is without health care. If you have no insurance, you go to the emergency room. Now, that's the most expensive way to dispense health care. We don't need to do that. But that's the story. The emergency room of a hospital has the absolute need to take care of you if you come in with a problem. So no one is completely without any kind of care at any given time. It is not an optimal situation. We certainly need to change it, because our hospitals are going to bankrupt if we continue to do what we're now doing. But I am very worried about health care having the government have a heavy hand and a new bureaucracy in setting up this program. This is a scary situation as far as I'm concerned.
Well, I think I would be more in agreement with Corrie on this issue. I do believe the federal government has a role. I do think they've managed Medicare quite nicely. The administrative overhead for Medicare is far lower than it is for private insurance companies, which is one reason why we're seeing accelerating costs is in the healthcare coverage is administrative fees that are being charged by insurance companies. So I do see that the federal government having a role. I don't see them being the providers of care, but I do see them being the taking a stronger administrative role, and for that reason I believe that the public option should be factored into any health care reform. Mike mentioned emergency rooms, and they do serve a very good purpose. However, the federal mandate that requires that emergency rooms treat anybody who comes to their doors with an emergency says that they must triage that individual and stabilize that individual, but they have no further obligation beyond that. So that person may have ongoing needs beyond what can be provided in the emergency room, but that individual may not have any way to have those medical needs met once he or she leaves the ER.
More on the public option later. We witnessed an explosion of opposition to health reform at the town hall meetings held around the country this year. In your opinions, what were the underlying causes of that opposition?
Well, I might want to go ahead and take this one to start. We, the Kansas Health Consumer Coalition, attended, and I was a panelist on numerous town hall meetings across the state this year. And I think the one thing that I saw the most of was the lack of information and maybe misinformation that people had who were attending the town halls. I think that, for opponents of health reform, it's very easy to use scare tactics. It's much easier to scare someone than it is to come up with a way to fix the system. And so as a panelist at many of these, I witnessed, I would use your word, an explosion based on, maybe special interest groups that were there that would tend to hype the crowd up, handing out misinformation, everything from the rationing of care to the boards that were going to put the elderly to death. I mean, it was just outrageous information that these people had. So that would be what I would say, lack of information and misinformation.
Well, I think contrary to what my European friends tell me, the American electorate is not stupid and it's not naive, and I believe that most Americans don't always pay a great deal of attention to run-of-the-mill issues, but this issue is one that is very, very important to everybody, and so people become emotional over it, and the administration has done a very lousy job in selling the program. The information that came out was often wrong. We heard there's going to be a public option. No, there's not going to be a public option. Maybe there's going to be some kind of public option, but not exactly a public option. We heard illegal immigrants will not be covered, but yes, they will be covered. We heard abortion will not be federally funded, but yes, it will be funded. There will be no rationing, but rationing already exists in the Medicare program. I can show you any time that we are now rationing in Medicare as to what treatment is acceptable, what drugs you can get, and what you must take. This is a bureaucrat in Washington or wherever who is going to determine to some degree the treatment you're getting, and this is what upsets people. Now, I'm sure there were some people that went over the wall in terms of the death panels and all that nonsense, but whenever you have rationing, the kind of thing can happen. We are going to determine, a man like me, I'm going to be 80 years old in a few years, and I'm coming up with some disease that is going to cost an inordinate amount of money. Well, maybe we're going to look for some alternate treatment. There is going to be bioethical decisions that have to be made. And that's what people, I think, riled people up. They got them emotional. And the other thing is, they couldn't get information. I mean, no one in this panel, I would say, knows exactly what's being proposed. The Pelosi bill is 1,900 pages. They are rushing it through, and we're talking about issues that are vital for the nation for a long time. We need to take our time. We need to debate these issues. We need to have input. We need to not run against the insurance companies. It's all the insurance companies' fault, and the government is going to fix it. That's what's come out. That's what got people emotional and passionate. And our own congressman, I can't get answers from him. He hides. You can't. When the people in power don't know, and then they give you information, why would you be surprised that people are upset?
Well, I agree with much of what each of my two co-panelists have said here. I do think that there was a lot of misinformation and lack of information, but healthcare is a very personal thing, as we've said, and for those people who have health care, the idea of reform can be very threatening because they think, oh my goodness, I'm happy with my health care, but if they're going to reform the system, this may mean that I won't have the same health care that I have right now. And so people's defenses kind of go up, and they're reluctant to change. They're comfortable with what they have. And so they're more susceptible, I think, to listening to some misinformation because it kind of feeds their fears a little bit. And so I think that because we all consider healthcare such a personal and private thing, the idea that there might be some changes is very threatening. And then when the misinformation comes out, it just underscores that. So I think people were not listening with their brains in some of these town halls.
May I say one more thing on this, and then I'll shut up. One of the issues that I find very interesting is that while Congress is in a hurry to push this legislation and ram it down our throat to some degree, they are not willing to take it themselves. The question that has been asked, will you, Congressman, Congresswoman, Senator, staffer, take this program that you're forcing upon us as your own? And the answer, of course, is inevitably no. They got it out of committee, by the way, 12 to 11. Some doctor from Louisiana put the bill in. But I will promise you, this bill will never see the light of day. Pelosi will never bring this to the floor. And therefore, we're talking about an elite that gets one type of care the federal government, the employees, and Congress, and the rest of us take what they prescribe for us. And I don't think that's the American way.
Speaking of bills, over the past few weeks we have seen the emergence of 3 health reform bills in Congress. They have many similarities, such as requiring that all insurance carriers accept every individual who applies for coverage. The most important difference is that the House bill and the Senate Health, Education, Labor, and Pensions Committee bill includes the public option health insurance plan, while the bill that came out of the Senate Finance Committee does not. How do each of you feel about the inclusion of a public option for the U.S. healthcare system?
I think that right now, as I see it, the public option is the only way to bring into the market those that are currently uninsured, which are millions more than there were last year. We need these people in the market. We need them so that we can spread the risk so that all of our premiums can go down. We need our young adults. We need the low-income single moms. We need the childless adults. We need these people in the market. A public option, in whatever way you want to frame it or dice it up, is the only way I can think of that can standardize benefits and costs at this particular point. I think it also brings an element of transparency to the system that we don't currently have. And so, you know, the one thing that I have held strong in support of, no matter what these bills look like, because they do seem to change day by day, is the public option.
Well, I'd earlier expressed my support for the public option. I do believe for all of the reasons that Corrie mentioned, we need to include a public option, and I think we need to focus on the word option. Nobody will be forced to take the public option, to choose that, but it should be made available to anyone who wants to go that route. So,
and who is eligible to go that route.
That's right, yeah.
This is not something that middle-income workers and high-income workers will be privy to. I mean, this has got a federal poverty level percentage attached to it, which, quite frankly, is on it for an advocate's side is not near high enough. I'm sure that Mike will talk about that in a moment. But I mean, I could have used this all the way to 400% and been just very happy.
Yes.
It didn't make it that way, and we knew that it probably wouldn't. But it's not. This will not be something that everyone's privy to. You have to make not a lot of money. I mean, you have to be very low income to qualify for this.
Well, ladies, forgive me, but I disagree. Philosophically, I believe that competition is what drives prices down. Competition is what makes services better. And there may be many things that we can do that we are not doing. For example, right now, as you know, the administration is fighting this war against the insurance companies, but we do not allow insurance companies to sell insurance across state lines, because each state has to have an insurance commission to control. That's a very high cost. It's something we could do immediately and save a lot of money. There are many other things. But my problem with the public option is this. It's the camel's nose under the tent. The government competing with the private sector. And if we go to 400% and I say I can make $96,000 and buy into the public option, what am I going to do? I'm going to look at my insurance bill and say, wait a minute, it's cheaper to go with the government. I drop my insurance. I'm going to buy the public part of the insurance. So therefore, the government is going to get much of the market, and the private sector is going to lose market, and prices will increase. The cost is not going to go down through public option. In Kansas, we talked about this before in terms of S-chip and Medicaid. We're at a 250% level of poverty, which means you know, if you have 4 children, you can make $70,000 a year and still get the government to Kansas pay for your insurance. Whether this is fair or not fair, I'm not here to defend it. What I'm saying is I am very leery to have the government provide services that the private sector can provide better. And I think looking at how government runs Medicare, Medicaid, and VA, I have no great confidence that they're going to do a better job than the insurance companies.
Let me just say this, because I figured that we might spend a little bit of time talking about debating the public plan. I think that Mike and I can agree that I don't want to see insurance companies going out of business. I have no desire to advocate for Blue Cross closing their doors. I have Blue Cross. I'm very happy with Blue Cross. On the other hand, when you go to Blue Cross and you don't make the money possibly that the three of us at this table make, and you try to get an affordable plan from someone like Blue Cross, because I won't just pick on them, it's pretty much all the same. The word affordable is a real loose cannon, because that means different things for each of us sitting here.
You mean an individual plan?
Individual or family plan in the individual market. I'm talking about the individual market. The issue almost becomes, when you talk about affordable and you know, $70,000 with 4 children, quite frankly, I don't have children, but $70,000 doesn't sound like near enough money to raise 4 children to me. So to give people help that they need, you know, to get health care for their kids, I'm all about that. I want to see people getting the care that they need when they need it, and I really don't care at this point how this gets done. The one thing I want to say, though, in particular about Pelosi's bill is, and in the Senate finance bill as well, you know, they are looking at the insurance exchanges, and I'm sure that we can talk about that if you want to talk more about that. Therefore, not shutting down the private industry, but giving them the benefit of coming in so that they can compete for these plans and compete, because at this point right now, the insurance companies don't seem really wanting to insure the single mom who's got these kids who can't qualify for Medicaid. And the reason I feel that way is because the word affordable is not within her means. She does not have an extra $150, and that would be, that wouldn't even be a family plan, that'd be an individual plan in the individual market, you know, to set aside if she works, let's say, at McDonald's making minimum wage. I mean, she doesn't have that extra money. So then you have to look at, does she pay rent and keep her apartment, or does she pay for her insurance? And this is, in my coalition, these are calls that we field every day. I mean, where do you go to get these mythical insurance policies that everyone says are affordable? And Blue Cross has even called one of theirs Afforda Blue. Well, Afforda in the Afforda Blue title is very misleading, because it's not affordable to many of us.
Some people feel that the U.S. healthcare system should be geared more toward consumers choosing their health providers based on quality and cost. Do you feel that Americans have enough information to make those kinds of choices at this time? And if not, what should be done to make that information widely accessible?
Well, I have absolutely no information on that on that topic, but just my gut feeling, if you will, is that I don't think most of us have the ability to compare and contrast insurance plans, because they all vary from among and across companies, and I think it would be very difficult for us to rely completely on our own individual decision making to scrutinize insurance plans and then say, I think this is the best one for my family or for me. I would find that a challenge for most people.
I would agree with an earlier statement that Mike had said, and I do not believe that people are stupid or ignorant when it comes to costs. I believe that, you know, for instance, last night I was at the grocery store. I see people in front of me using coupons, you know, using their calculators to calculate things. We right now are trying everything we can to save a nickel. The issue with healthcare services, and I think that we could agree on this, is that is the one service that we get when we go to the doctor that we really have no idea what amount we're paying for before we actually go. You know, when we go to buy a car, go to buy a house, you know, we know what the cost of that's going to be. When I go for a yearly mammogram, if you were to say to me, Corrie, how much is your mammogram every year? I would say to you that I have tried to get that information out of my hospital, Sibley Hospital up in Washington, D.C., who does the mammogram, and I've tried to get that information out of Blue Cross. I have no idea, and I actually work in this field, how much a mammogram costs. You know, it's very difficult, even for those of us who deal with insurance policies, billing summaries, you know, on almost a daily basis, to weed through this. It is not transparent. It leaves consumers kind of chasing their tails, and this is the #1 issue, in my opinion. Transparency, lack thereof.
Well, I can't disagree. I think that we need to make sure that the consumer, it's our body, our disease, our broken bone, whatever it is that's being treated. We need to find out what this is going to cost. What we ought to also do, and I think I do for my family, we find out where is the best possible provider. My wife has a very serious condition right now as a post-herpetic neuralgia, which is a horrible, horrible thing in terms of pain. And we've literally visited with several physicians to get referrals to somebody who would treat this condition, because it's a rare condition. So we need to inform ourselves, and education is important, and we need to also send a bill for whatever medical providers charge to the consumer. So I know this is what they charged me. And then I'm maybe becoming a little better consumer. Maybe I'm going to be taking a look and saying, well, this is outrageous, or it's adequate, whatever. So we need to inform ourselves, and we need to make sure that those of us who are in public service make certain that the information is available and is given in the proper form so that people can make a choice. Because, you know, amongst doctors there are different charges, amongst dentists there are different charges, you know. So while we may take the calculator and the coupon to the supermarket, we don't do that when we are picking a dentist, for example. You know, one dentist may charge $2,500 for something, while the other one charges $1,800. So that is something that certainly we need to look at, and it will help to some degree, but it's not going to solve our overall problem.
I think you also add in the time factor. You know, everybody's busy. People, some families, the husband or the wife or both sometimes are holding down 2 jobs. They're raising their kids. They have a lot of other things to do, and just the time element alone to try to gather the information and then assess it. I think most people would just throw up their hands and they'd go to somebody and say, well, you know, who do you use or who do you recommend? I think it would put them in a most of us in a very difficult position.
But we need to attend to it, because I know when I buy a car, I go to 5 dealers and I go on the internet and I see you ladies shopping for clothes. I take a chair and sit down and wait because you take forever, because you're very, you know, you're very concerned. It's important to you, and I think we need to make sure it becomes important to those of us who are ill, who are in need of medical care, to inform ourselves the same way. I mean, at the least the same way as to should I buy this shirt or that. And right now, because there is no responsibility for the consumer, you know, we can go anywhere, we whip out our card and they take care of us, which is I think the wrong approach. That's why I favor healthcare, the health savings accounts. Yeah, well, sometimes I stumble over my tongue. Health savings accounts are very important, because it's your money you're spending, you see, and they are, we'll talk about them later, but I think they are one tool that we could use to bring this idea forward, that consumer become more informed.
Let me just finish by saying this. I think that the last thing I want to say about the issue of price transparency is there is a very it's very unfair, I believe, for consumers who don't have health insurance right now to be charged the full sticker price, if you will, where those of us who have Blue Cross are able to get these services at a negotiated discount because we are fortunate enough to have health insurance. And, you know, the reason that price transparency becomes such an issue on my radar is because for those people who are uninsured and in major amounts of medical debt right now, and they're trying to pay these medical bills off, it's just simply not fair that we're punishing the people who have the least ability to pay. And we're charging them $5,000 for a CAT scan that I would have been charged $2,350 for because Blue Cross has gone in there and negotiated the discounts with the hospitals or with the doctor's offices. I think it's just so unfair that we're punishing the people who have the least ability to pay.
Well, speaking of health savings accounts, I was going to ask you about that. You know, some camps in this debate, you know, advocate them as the way to empower consumers and lower health costs, while others say that these accounts only work well for relatively well-to-do consumers who are in relatively good health. Would you like to revisit that?
I've heard that argument, and there is some validity to it, but I maintain health savings accounts are good for everybody. If you work, by the way, McDonald's doesn't pay minimum wage, they pay more. We argued that last year. If you work at McDonald's or wherever you work, and you're a young person, you don't need insurance. You know, I didn't break a fingernail until I was 60 years old, and I broke both ankles and knee and had chest surgery. You know, it cost everybody a lot of money. But between the time of 19 or 20 and 60, I was never in a hospital and I was never sick. I don't think I ever saw a doctor more than once or twice a year. So what I'm saying is, if you are even with a modest income, put this money away for yourself. It's going to be there. What we ought to do, and I have the solution to our problem right here, write it down, and there we go. Require everybody to have catastrophic insurance. So that if you have what I did with the 5 bypasses that cost $80,000, you're covered for that. But if you have a sniffle and a cold and you go and it costs $30, $40, $50, you pay for it yourself. Then if everybody has catastrophic insurance and you have a health savings account, you are putting money away for yourself. And you are going to be a better consumer because you're going to ask yourself, well, wait a minute, it kind of aches a little bit here. Should I wait a couple of days and see if it goes away, or do I go see somebody today? You make the decision.
Here's, I guess, what I think about that. I actually, believe it or not, most of my family has health savings accounts. However, not me, but my family, my father makes quite a bit of money. He also is relatively healthy. I, however, since we're sharing our health stories here on the air, I too have cost the system millions of dollars, as I am a breast cancer survivor. The thing that I disagree maybe with Mike about, I do believe that consumers spend their own money wisely. 2 issues, though, about that. McDonald's, who pays apparently above minimum wage, that's good for them. When you, again, I'll go back to the family who, let's say that both parents are working at McDonald's and they've got 2 kids. It is so difficult right now to save any money and to put any money away. It is just almost impossible. And I look at my own monthly budget, and it's almost impossible for me right now to do that. The other thing with that is, I believe so strongly that people should have the care they need when they need it. You know, what Mike said about catastrophic coverage, I don't wholeheartedly disagree with that. Here's the issue, though. How do people pay for that when they don't have any money, when they legitimately don't have any money? Medicaid will pay for the low income. It's those people in the middle, and Mike said that in the opening comments. It's those people in the middle. But the problem is, in the old days, we used to have a huge gap between the haves and the have-nots. What has happened is the gap is shrinking, and you know, the haves are now the have-nots, whether it be they've lost their job, both parents have lost their jobs. You know, I think about the East Coast. I mean, I know of so many people right now that are laid off. it's a horrible time to ask people to save because nobody seems to have any money. That being said, I do believe that consumers spend their money wisely when it is their own money. My issue is, if you're sick, you know, HSAs tend to have pretty large deductibles, out-of-pocket expenses which put people in medical debt, and generally you do need to be middle income, upper middle income, and relatively healthy. And so I guess I'm the adage that you were disagreeing with in the beginning, healthy and wealthy.
I don't really have anything different to add to the discussion on this one.
Tort reform. One of the most contentious issues in the healthcare debate has been tort reform. Many people have said that reining in frivolous lawsuits is one of the most important steps we can take to lower healthcare costs. But in 2004, the Nonpartisan Congressional Budget Office pegged the costs of malpractice lawsuits at less than 2% of healthcare spending. In your opinions, how big a deal is tort reform as we pursue health reform?
All right. In the state of Kansas at the present time, it is not that big a deal, to be honest with you. But in other states it is, and I think we absolutely need it. And I speak here as one who has been through the judicial system on a big loss. My daughter, 16 years ago, got killed in a car wreck on the way home from college, and by a driver with marijuana in his system. And what was my feeling? I want to have this guy in jail for the rest of his life, and I want to own the trucking company. I mean, you know, if I'm a father who has a child or a baby that gets hurt in a hospital, I want to own the hospital. I understand that, but then I also understand that I'm going to inflict the cost on everybody else when I do so. And when we see tortious cases where the reward is in the tens of millions or more dollars, and when we see situations where obstetricians leave the field or leave the state because they no longer can afford $200,000 a year in insurance premiums, because we are a very tortious society. Many of us wake up in the morning, who can I sue today, you know? So we see this happening, and I think we need tort reform. I think we need to set a cap, a reasonable cap. In my own case, my daughter's situation was there was a $100,000 maximum for a wrongful death, and with other provisions in the law, we had to settle for like $55,000. It doesn't bring her back. It wasn't my money. We took this money and added some to it and established a scholarship in her memory at the University of Dallas. So that was the point. But yes, I want doctors disciplined. I want hospitals taken to task if they mess up. And I think we need to also see to it that we're working on that side of it, because the doctor or the insurance company just paying a lot of money doesn't make it a better doctor. If he's a doctor who is not a good doctor, we need to either pull his license or put restriction on him or put him in retraining or whatever you want to do. What I'm saying is right now we're not doing that. We're trying to solve all these problems with money. And it's become an industry, as you well know. You see it on television every day where lawyers advertise, you know, have you got mesothelioma or whatever it is, we're going to get you a lot of money. And, you know, this is a cost to all of us, and we've got to stop it. We've got to put some limits on it. Whatever the limits are, they ought to be reasonable. The state of Kansas, our juries have been responsible. I have not seen a $150 million verdict, but in other states, you see that all the time.
I think Kansas has seen an increase in certain medical specialties from physicians that have moved from Missouri to Kansas for to practice because of the settlements that have been awarded in Missouri, and also because of the liability insurance that physicians have to carry. Particularly in the obstetrics area, and it's at least unless it's changed recently, a lot of OB physicians were transferring their practice from Missouri to Kansas for some of these same reasons.
I think that this goes, I would agree with Mike in saying that it's not an issue right now in Kansas, but I think that this goes hand in hand with the cost of healthcare services. For example, I mean, listening to him talk, you know, that's obviously, I mean, a tragedy. However, for the people who are not killed in automobile accidents, let's just use those as an example, and they are disabled then, permanently disabled for the rest of their lives, it costs hundreds of thousands of dollars, possibly even into the millions at this point, if someone is 16 years old, to live out the rest of their life. And there is a cap generally on auto insurance coverage, you know, that'll only pay up to a certain point. And these people have got, you know, all of these health expenses then that have to be paid by someone for the duration of their life. And I think that it does go hand in hand with the cost of healthcare services. It is just, it's gotten out of hand. People can't afford to get sick. They can't afford to be disabled even for a short period of time, because then they'll lose their job, and guess what happens when that, you know, they lose their health insurance. It's just a cycle. It's just a never-ending cycle right now that all seems to be very wrapped up in how much healthcare services cost in this country.
There is no cap on survivors of accidents who have economic loss forward. The 16-year-old in a wheelchair, for example, is going to get money up to, you know, his normal retirement age, or he's going to be on Medicare as well. So there is some protection there, but I agree that we have, in fact, I've introduced a bill a couple of years ago, and we took the $100,000 limit to $250,000. I wanted to take it to $1 million, but I couldn't even get 500. But what I'm saying is that, you know, there is a need to compensate people for wrongful actions in the medical community, or wrongful death in terms of accidents, etc. But we need to make sure that if it's 2%, as you say, of our medical costs, that's an awful lot of money. That is a great amount of money nationwide, and we ought to maybe bring it down to 1% or 0.5%.
Healthcare experts frequently point to like variants of treatments as a problem in our system. They say, well, why is it if you have a certain condition, you're more likely to be treated for it in a different way in the Pacific Northwest versus Florida or Michigan? And Representative Kiegerl said, you know, you have a fear of a federal government takeover of health care, but what about the concept of the federal government leading the way in establishing evidence-based procedures and treatments to try to determine, you know, scientifically what is the best treatment that makes the most sense, and to try to have it adopted as much as possible?
Well, I'm less optimistic than you are that the federal government is capable of doing that. I believe that if you have a broken ankle, that you can get perfect treatment in Kansas City. There's many orthopedic surgeons that will take care of you. If you have a very, very strange disease, a very rare disease, you need to take a look and you need to inform yourself. But I think the present system is adequate in getting you to the right caregiver if you make the effort. I don't trust the government to say, this is what we're going to recommend, one and for all, regardless of what the condition is. I don't think standardization in that respect is good. I think I should have the opportunity to go to Mayo or to go to St. Louis or wherever I want to go to be treated. And the information is available. I can go on the internet nowadays. You can find all kinds of information on who is doing what. And so I don't believe that we need the government. My fear then is because you have a government agency with a huge bureaucracy that they establish standards, and that's it. You're going to get this and nothing else. And that would limit the potential treatments for people who have unusual situations. So I believe in the private sector still.
If the three of you could wave a magic wand and create what you feel would be the ideal health care, health insurance, health coverage system, what would it look like and how would it work?
I would say that health care would be a right, not a privilege. And I would say that people across this state, in every community across the state, people were able to get the care that they need when they need it without having to worry about if they're going to have to file bankruptcy in order to pay for their health bills.
Well, I can't disagree with any of the issues that Corrie offered. I think that is an ideal goal. Those are ideal goals to shoot for. I'm not sure how we're going to accomplish that, but I think if we don't begin to look at health care as something that everyone is entitled to, if we don't begin to follow that mindset, we're never going to get there. I think two-thirds of all bankruptcies filed in the country last year were because of medical bills that just tipped people into virtual bankruptcy. Two-thirds of the bankruptcies filed last year. We've got to find a way to make health care more affordable for everybody, and until we have that as a commitment in this country, we're going to continue to struggle with the haves and the have-nots in terms of being able to get the medical care that every one of us deserves.
Well, I have a magic wand, and I want everybody to be taken care of. Unfortunately, I don't have the money that is necessary to go with the magic wand, because we have really not discussed yet the costs of whatever is being proposed. And this was one of the other issues where I believe we got some fuzzy math from the administration. They said first, we're not going to add anything to the deficit, and then it turns out we're adding only about $1 trillion, which, if you remember your math, is 1,000 billion, and a billion is 1,000 million. So we're talking about a little money there, which we are burdening our kids and grandkids with. So we also heard that Medicare will be losing $400 to $500 million of money because we are going to fund Medicaid with that. So there's been some very, very fuzzy math coming out, and the costs, of course, is what we're looking at. If we had all the money in the world, everybody would have Cadillac care, no question about it. Unfortunately, this has to be paid for, and it's you and I who pay for it, and we need to see what is it we can and cannot do. And I think that is the real crux of the issue, that we are financially not able to say we can do everything we want. It's going to have to be incremental. This is why I have a problem with this fast-track approach. You know, in 3-4 months, we're going to have everything changed. We need time to take a look at individual issues and then pick priorities. But I cannot disagree with the notion that everybody needs to have health care and be taken care of. That is absolutely right. I am not quite sure, however, whether we should be funding health care for illegal immigrants as well. They've already broken our laws. Whether this is a reasonable thing, I'll leave to another discussion.
Well, you're right about the issue, Mike, of what a new healthcare program is going to do to the deficit. But the flip side of that is the increasing costs if we don't do anything. Right now, we're at $2.1 trillion that we're spending in healthcare costs in this country. That was in 2007. Those costs are escalating every year. So the longer we wait to make changes to major changes to our healthcare system, the more costly it's going to be, and the more people who are going to be shut out.
The only question I have is, does it have to be done by December 31st, 2009, or do we have time to involve a lot more people in the process that are not being heard right now, that have ideas, that may have merit, in order for us to get the program that really does what we all aspire to do? I don't want to see anybody ill and not getting care. I don't want to see anybody going bankrupt because they can't afford medical care. But the question arises, who is going to pay in those circumstances, and you know, where we're going to get it.
You mentioned some health systems in other countries. Are there certain other systems, say England, Canada, and Germany, that some of you admire and wish that we would borrow some of their ideas and practices in our system?
Well, I think that Mike mentioned 3 countries that he wasn't fond of. How it's good then that the one that I'm going to talk about wasn't on his list. I don't hate France. I have been to France.
France has a good system. Yeah.
And you know, their costs are well below half of what ours are per capita. Ours are about $8,000 a person, and theirs are about $3,600. And they've got relatively solid outcomes. And it's funded through taxes. That's how they're funding it. So it's not bad. It's not bad. That would be the country I would go for.
I think we've about 3 minutes.
I can't quote any figures, but I've seen a number of tables, and I'm sure you all have seen the same ones, that look at the healthcare costs in the United States compared with a variety of other countries, and the health of the people in those countries. And the U.S. scores poorly in all of those areas relative to many other countries. So I think there are models around the world that would be available for considering if we wanted to choose to look outside this country for additional ideas that have not been brought forward for consideration in the U.S.
Well, I must agree with the spending. We're spending more than everybody else on medical care. We're also spending more than everybody else on education, and our kids don't compare to the international outcomes in terms of what they know. We're like number 29 in math and 27 in science, etc. We have a problem. We're spending too much money, and we're not spending it wisely. That's the problem. Now, my problem with the Europeans are the French system is not bad. The German system is not bad. They are cheaper, and but they ration care. There is no question they ration care, and if you have you want to go to a specialist, you have to have a referral by a doctor. You're not going to necessarily get to see whoever you want to see. You have no choice.
And I'm afraid they're rationing our time.
Our time
here.
already. Well, I'm sorry.
Thank you very much for your comments and spending the time with us, and it's been very educational for me, and I hope the viewers, and thank everyone for watching Let's Talk Issues.